My particular interest is in lesions that affect the pituitary gland and the bottom or the base of the skull. Now, nearly all of these tumors are benign tumors, that is, non-cancerous tumors. They tend to grow very slowly, they don't spread in the body, and they usually come to attention by the course of some gradual kinds of symptoms. However, they can be quite serious because of the proximity of these tumors to critical structures like the vision nerves or the pituitary gland or the major blood vessels around the bottom of the brain. And their treatment can be fairly complex, and it often involves a multidisciplinary team, including a surgeon, an endocrinologist, a radiation oncologist, and something called a neuro-ophthalmologist. That's a specialist who specializes in disorders of the nerves to the eye. What we do in the Pituitary Center is bring in all the patients, give them a thorough evaluation of their endocrine status, their vision, and all the associated factors, image them with the highest quality and highest strength images, and then have a multidisciplinary assessment of what should be done. In pituitary tumors, for example, the treatment may involve doing nothing and just monitoring the tumor over years to make sure that it doesn't cause a problem. In other cases, the treatment may be a medicine, simply a pill that will suppress the tumor. And in some cases, surgery is required. In some cases, we use a special kind of focused radiation called CyberKnife. But that decision is made by a team that is really looking at every aspect. And in most cases, there's a combination of those treatments. The bottom line is that we can treat the great majority, if not all, of tumors in and around the pituitary gland and the skull base with a very minimally invasive surgical approach and this holistic, comprehensive, multidisciplinary care that will allow them to lead long and normal lives. The surgery for pituitary tumors has become very non-invasive and is almost an outpatient procedure. The majority of these lesions can now be removed through the nostril without any incision. This is done by utilizing the most advanced imaging and intraoperative navigation systems that are like a GPS, and they allow the surgeon to work through the small opening of the nostril and take out actually quite large tumors that are pressing up against the brain. This is all done in a fairly short operation that takes about an hour. Afterwards, the patients are observed for 18 to 24 hours and then are discharged home, usually to normal level of activities. So the surgical treatment is very straightforward, safe, and highly effective in removing these tumors. In certain cases, the tumor cannot be entirely removed, but as a benign tumor, we can then bring to bear other kinds of treatments to control the tumor. This may include focused radiation, such as CyberKnife, in which a robot literally directs hundreds of beams to the site of the remaining tumor. And just like a magnifying glass in the sun, those beams converge on this precise spot where the tumor is sitting. That spot gets a very, very high dose of radiation, and everything around it essentially gets little to no radiation. So we can safely ablate or burn any residual tumor as a single treatment outpatient procedure, and patients go on to live a normal life. Through all of this, we have an endocrinologist who's following the hormone level of the patients. In addition, our endocrinologist works in very close collaboration with your local endocrinologists in the Everett area and coordinates care so that ongoing hormone treatments can be continued at home without the need to continue to travel outside of Everett. So we think that especially for pituitary tumors, we can bring to bear some of the greatest expertise and technology in the world, treat these benign lesions in a very non-invasive, in a very efficacious way, bring patients back to really a normal life and maintain them in that state for years and years to come.